Did you know that most of the treatments your doctor recommends for a spinal disc condition will never provide lasting relief? If you look at the current research about the typical treatments that are recommended by most physicians, here's what you'll find. Let's talk about medications first because medications tend to be the first choice of treatment for most doctors. Many times you'll be prescribed a combination of painkillers, muscle relaxers, and anti-inflammatory medications. Now, the good news about medications is that usually they do provide relief in the beginning, but the problem is once you stop taking them, the pain will usually return, and that happens for a reason which we'll talk about in a little bit in this video. One of the major concerns with these medications is the side effects. Many people are just not able to function during their normal daily activities while on these because some of them can be very potent. Now, the next common treatment we'll talk about is injections such as steroids like cortisone or epidurals. According to a research study entitled Increases in Lumbosacral Injections in the Medicare Population from 1994 to 2001, which is done by researchers named Friedley, Chan, and Deo in the journal Spine in July of 2007, these types of injections are effective as little as 18% of the time. So the outcome of the study wasn't surprising. The outcome was that this is not the best option for treating disc conditions, and it certainly isn't the most cost-effective option either. Also, when injections do help a person, it can be very deceiving because yes, the pain goes away, but the problem is that the underlying disc condition didn't actually heal. So you think that you're okay and you continue going about your life and doing all the things that got you into this problem to begin with, and then once the injection does wear off, all of a sudden the pain comes back, and sometimes it's even worse and it's more difficult to treat at that point. The next common treatment that we'll talk about is physical therapy. Now, I'm a huge fan of physical therapy. However, I believe that physical therapy needs to be done at a certain time and in combination with other treatments if you want to experience the most benefit from it. There's an appropriate time and a place for everything, and that's something we'll be discussing more during this video as well. Now, surgery is the last resort, and there's very good reason for this. First of all, studies show that the success rate of conservative care is better, or at least equivalent to surgery. And conservative care would basically be anything that doesn't involve surgical procedures. Now, the first four research studies that I have listed here on the screen are just a few of the studies that have shown this. And because there can be complications with surgery, most doctors will try everything else first because why would you take the risk of going through surgery if you can experience relief using more conservative methods? And in fact, one of the biggest concerns about surgery is the failure rate. According to the study, Related Factors with the Failed Surgery of Herniated Lumbar Disc, which was done by a research hospital in Spain, the failure rate of spinal disc surgery is as high as 40%. Now that means that at least 1 in 3 people who have spinal disc surgery will not experience relief. And in addition to that, they found that the failure rate increases to over 50% when an individual has surgery more than once. So if you're in that position where you've already had surgery and are considering another surgery, you need to think very seriously about that, especially if your very first surgery failed. Now, another concern with certain types of surgical procedures is that they can actually cause the disc to degenerate more quickly. Now, what that means is that you develop arthritis in the disc faster than you would have if you didn't have these treatments. Now, a study in the Journal of Spinal Disorders and Technology entitled Accelerated Degeneration After Failed Cervical and Lumbar Nucleoplasty showed that 42% of the people who had this type of procedure showed more degeneration within the treated disc a year after the procedure than they would have if they never had the procedure at all. Now, for many people, finding out about your disc condition is a lot like what's happening to Kermit the Frog in this cartoon. Kermit is about to get some pretty bad news. He's about to find out that he has a hand inside of him somewhere that he never knew about before. And what I'm guessing is that your experience of finding out about your disc condition may be a little bit similar. You see, most of the time, at least with the patients that I've treated, what I see is that a person has some back pain, or maybe you have some pain that travels into your legs or into your arms or that sort of thing, and that pain causes you to see a doctor about it. Well, because you're not aware of what's going on, you just figure, well, the doctor can probably just give you a pain pill and you'll feel better, right? Well, sometimes the medication doesn't work, so the doctor has to order some tests. So they send you for some x-rays or for an MRI, and that's when they discover that you have a disc problem, whether it be a bulging disc or a herniated disc or whatever the case may be. Then the doctor has to tell you the bad news, which is you have a permanent condition that will never heal, and your back is never going to be right again. And you're basically just going to have to live with this for the rest of your life. Well, in my personal opinion, I don't think that we need to believe that, and research has now shown that a bulging disc, a herniated disc, and even a ruptured disc can heal without surgery. In the first study that I have listed here on the screen, which was done in China at the Wangjing Hospital of China, Academy of Chinese Medical Sciences, they found that 79.2% of the patients who had herniated discs and were treated with conservative care actually showed that the disc was healing on a CT scan. Now, what this means is that the herniation itself actually sucked back into the disc and the wall of the disc showed healing. And these results happen in just a 3-week period of time, which is pretty amazing. In the second study that I have listed here, they showed the same results. And in fact, in these cases, the disc had actually ruptured, which is the very worst case scenario that can happen with the disc. And the CT scans in this study showed that the fluid that had leaked out of the disc was actually reabsorbed by the body, and the disc was healing in just 3 months following that sort of a problem. So why aren't you seeing these same results? And why would most doctors tell you that a herniated disc will never heal? Well, the problem is most of the time the doctor doesn't know exactly what to do to get that to happen. And that's why they aren't seeing the results that are happening in the research that I'm sharing with you today. Now let me explain to you why I really made this video today. What I wanted to do is I wanted to basically clarify some of the myths that you have probably heard about your condition. I want to give you some information as far as what it is that you can do to not only get relief, but also to get your disc to start to heal properly. The problem with any disc condition is that it is very deceiving. Believe it or not, pain relief is the easy part of this situation. The hard part is actually getting the disc to heal. Now I'm going to be explaining a little bit about why that happens and what you can do differently to make sure that yours does heal rather than what's happening to you right now. So what I'm guessing is that if you're watching this video today, one of a few situations is happening here. Either you're in a lot of pain and you need some relief, or maybe you've had this problem for a while and maybe you're not in so much pain, but you're more interested in trying to strengthen the area and make sure that the problem doesn't return again. Or another situation may be that it's where you've had the problem before and it seems to clear up and the pain goes away and you feel really good for a while, but then all of a sudden the pain returns and you don't really understand why that's happening. Well, no matter what the situation is that you came to my website for, I want to tell you that this video is going to be worth your time in watching because I'm going to be answering a lot of questions that people have about spinal disc conditions. So here's what our goal is for today. First of all, I'm going to be telling you about a treatment program that will finally help you eliminate all of your pain caused by a herniated disc or a bulging disc, and most people experience relief in 2 weeks or less. Now you may notice that I keep saying herniated disc or bulging disc, and you may be wondering, well, is that the same condition? And the answer is yes, to a certain degree. There are 3 stages of a disc herniation. The earliest stage is what we usually call a bulging disc. Typically the middle stage is what we refer to as a herniated disc, and the final stage is where the disc actually ruptures. And I'm going to be showing you some pictures of this in just a little bit, so this all will come together for you at some point. Now you might be thinking, really? I can get rid of my pain in just 2 weeks or less? And the answer is yes for most people. I've helped a lot of people with this condition, and that's typically what we see. No matter how severe your pain is right now, usually pain relief is actually the easy part. That's the part that I can help you with pretty quickly. So why are the treatments that we discussed earlier not effective most of the time? Well, here's the thing. We have to understand a little bit about what's happening with this condition. So what I want to do is I just want to show you a couple of pictures here on the screen, and we're going to start over here on the right side with this image right here because this is what a normal disc looks like. Now let me just orient you a little bit. We're actually looking at this from the top down, and this circular structure here that I'm outlining, that's the disc itself. Now a couple other things that you'll notice on the screen, directly behind the disc you'll see the circular structure, that's your spinal cord. Coming off of there you'll see these pink things, and these are the spinal nerves. And then right behind that, this is the bone. So these are the vertebrae that surround your spinal cord and that make up your spine. Now the nerves here are really important, and I want to go ahead and point this out to you because your nerves control everything inside of your body, and they're very sensitive. They don't tolerate any type of pressure because they're controlling everything inside of you. Now your disc is also very special because the disc also is made to act like a cushion, and that's really its main function. Basically what it does is it separates all of the bones of your spine, and it will absorb shock so that the bones don't rub together when you move, which would actually be very painful. Now, if you look a little closer here, the way that your disc is put together is kind of like a jelly donut. You have a jelly-like substance in the center of the disc, and you have a strong outer covering that surrounds the disc and keeps that jelly where it belongs in the center. Now here's what basically happens with a bulging disc or a herniated disc. If you look at the picture in the middle here, what you're going to see is that for some reason this outer covering has torn here and it's been damaged. Now this can be caused by injuries such as a car accident or a slip and fall, or it could even be that the disc started to become weak over time because you have too many toxins in your body. And that may sound weird to you, but for example, we know that people who smoke tend to have a higher incidence of disc conditions because the toxins from the smoke will actually weaken the outer layer of the disc. Now, it could also happen because of a hereditary situation where maybe you have a family member who has this problem also, and then you were born with a higher likelihood of developing the condition, and what it'll do in that case is it will develop over a period of time in that case. Now, either way, the outer covering will get weak and get damaged, and now the center or the jelly will start to shift into the area where the wall is weakest. You can see that happening right here on this picture once again. Over time, this condition is really tricky because what happens is that the bulge will become bigger and bigger, and eventually it's going to put enough pressure on the nerve so that the nerve will become aggravated, and now you're going to feel pain. So that's basically what we're looking at in the picture over here on the left. You can see that the disc has gotten or the disc bulge has gotten larger, and now that nerve has some pressure on it, and now it's getting aggravated and irritated, and now that's why you're going to feel the pain. But here's the thing that may surprise you about this condition. Not only will you feel pain in your back or in your neck where the actual injured disc is located, but because the affected nerve is controlling something within your body, whatever it controls is going to start to give you problems also. So for example, let's say that I have a disc problem in my neck. Well, the nerves in my neck control my shoulders, my arms, and everything in my chest. So things like my heart, my lungs, my rib cage, all of these things will be affected by those nerves. So it's very common that a person who has a herniated disc in the neck can have pain that travels into the arms, or you might even get some numbness into your fingers or your entire hand. So the symptoms will be different, and sometimes people don't put two and two together and realize that it's actually coming from their neck. The same thing is true with your lower back, where you might develop pain going down to your legs. It's also common to develop problems with your digestion, such as a lot of constipation or even diarrhea, because all of these things are affected by these nerves. Now here's the reason why I'm telling you this story. The main problem with traditional treatments for disc conditions is that they focus on one thing, and that's the aggravated nerve. They want to reduce the inflammation and swelling around the nerve so it feels better. Now that's fine on the surface because it does work temporarily, but the problem is if they do that, they only get to the point in the middle picture here where the nerve is no longer aggravated, so you feel okay and you feel like you're normal, but the problem is they haven't done anything to actually fix the disc. So guess what's going to happen in these cases? Over a period of time, the disc is going to start to swell more and more again, and you'll be back to the way that you were right before. So that's why with this condition, it's very, very common for a person to feel like they're better, and then all of a sudden, out of nowhere, you have a flare-up of pain again. That happens because it wasn't treated correctly and it didn't heal properly in the first place. Now, what is the real underlying problem here? Why is it so important that we get the disc to heal rather than just focusing on pain relief? Well, let me ask you a few questions. How do you continue to function if the pain keeps returning? I don't know about you, but I have a life to live. I have family that I have to take care of. I have friends that I want to be with. I have a job that I have to take care of too. I can't do those things if I have so much pain in my life that I can't even function. And I don't want to lose any time out of my life, and I know that you don't either. How much work can you afford to lose when you have a flare-up? This is the type of condition that can get a person down where you can't even work anymore. And I don't know about you, but I don't know a lot of people who can lose their job for a week or even longer without suffering consequences from it. What is your personal life like when you're in pain? I'm not a very nice person when I'm suffering. Now maybe you're better than I am, but personally, I'm not good to be around if I'm hurting. And you tend to upset the people that you care about the most in these situations, so we want to try to avoid that. And then not to mention all the testing you have to go through with this condition, such as the MRIs, the EMGs, and all of the other uncomfortable things that you have to go through just because of the constant checkups that you need with this condition because, like I said, it never really heals completely if you're going the traditional medical route. The real underlying problem with any disc condition is that it dramatically affects your way of life. That's the real issue here. How do you get the disc to heal so that you can continue living your life without pain and without being limited? Well, guess what? It's not your fault that you didn't know that there was something better you could do, because the problem is that your doctor probably didn't know. Most doctors tend to get very focused on what they do, and they don't look outside of their discipline to see if there are other methods that might be more helpful for the condition. So in their mind, if they give you what they have to offer, which are the medications, the injections, or other things that we discussed, and they don't always work for you, well, they don't really have any other option available for you. So you end up thinking that you just have to live with this for the rest of your life. And yes, if you just stay with traditional treatments, you would, because they don't have any other options. However, I'm here to tell you that there are a lot of options that you can use that your doctor may not know about. So they couldn't tell you about them simply because they just didn't know. Now you're probably thinking at this point, is this guy for real? He's saying a lot of really big things, telling me that I can get out of pain in as little as 2 weeks, telling me that there are options available to me that my doctor doesn't even know about. And come on, your doctor went to school just as long as I did, so why would you believe that? Well, the truth is, you should be skeptical. There's a lot of misinformation on the internet, and in my opinion, it's better to listen to the people who I've helped.
My name is Bob Edmonds. The year 2000, in September, I was hit from behind in my car. I was getting in and out of my car. My car was stopped, and it gave me 3 herniated discs and a nerve problem in my left hand. Every morning when I woke up, it didn't matter when I got out of bed, it was excruciating pain. And I knew it was going to be there, and it was there every time I got out of bed. If I got down on the floor, I couldn't get back up again without somebody helping. And that was pretty bad. I have seen one other doctor. It was not successful. And I was giving up. And I received a flyer in the Sunday paper from the Spinal Aid Center. Decided to give it a shot. During the first treatment, at the end of the treatment, I walked with far less pain from the table into the recovery room, and it's the first time that I had that little bit of pain in 8 years. I'm going to say after about 10 sessions, 0 pain. I stood tall, like I haven't done in a long time, had no pain at all. Spinal decompression has changed my life completely. I was going to make a trip to China to the Olympics this year, and I was very much concerned that I wouldn't be able to do it before I came to the Spinal Aid Center. I said, I'm here because I want to go to China. If you can make me well, I'm going to China, and I'm going to China. It's been now, I don't know, 3 months, 2 months, whatever, since my last treatment, and I'm pain-free. I get up in the middle of the night to go to the bathroom, it doesn't hurt. I get up in the morning and make my coffee, it doesn't hurt. And it always hurt before. I mean, excruciating pain. Doesn't hurt anymore. Doesn't hurt me to do anything anymore. Bend over, touch my toes. I just have to be careful not to lift things too heavy, but that's because of my age and because of how neglectful I've been really of my body in the past. There's another aspect to wellness, and that's the aspect of the attitude of the people around you that are giving you assistance. And from the very first moment I came to this office, it's been like a big family. It's been nothing but friendly. It's been helpful in every way. In every way it's been helpful. Helpful financially, it's been helpful all the way around. I have not one minus thing to say about either the decompression system, the office, the doctors. I have nothing to say bad about it at all. Nothing but good. It's as if my back has been reborn. I think that's That's exactly how I feel about it. My back has been reborn.